Well, I spoke a short time ago with the NDIS Minister Bill Shorten, where we discussed some of the rorting and the waste within the NDIS. But I began by asking for his reaction to my report of this coming budget surplus.
Well, we'll wait to see what the budget says. If that's the case, it is. But I know that Jim Chalmers and the whole Albanese government's working hard to present a really solid budget in the best interests of the people.
And you've got a very important responsibility in all this with the NDIS. Talk us through some of the rorts that are occurring. We had a report the other day, shower chairs retailing for $1,150 when you can normally buy them for $150, and other examples. How widespread is this?
I say at the outset to people on the scheme that the NDIS is here to stay, but we want to make sure that every dollar gets through to the people for whom the scheme was established. We've got to look at the best interests of people on the scheme. And providers, just some providers, engaging unethically, opportunistically, just ramping up prices as soon as they know the customer has an NDIS package, it's positively un-Australian. This idea that if someone's on a government package, they're fair game for a doubling or tripling or quadrupling of prices. I hear too many reports of it since I've become a minister. We want to clamp down on it. We want to kick those people out of the scheme.
Well, how can you do it? Would you have to legislate to do it, to prevent this sort of overcharging?
I think there's a range of ways to do it. Certainly I've been talking to Andrew Lee, who's got responsibilities for the Competition Commission. You know, I think this behaviour has got to be uncompetitive, and if it's not uncompetitive, then it should be deemed that. So looking at the competition laws. But if that can't get us there, what I also want to do is start providing expert panels so that we can... The Commonwealth pays for this. The individual chooses the gear, but the Commonwealth pays for it, sits behind the consumer. So we want to start negotiating with some of the wholesalers of some of the big common spends within the NDIS and say, we want consumers of the NDIS not to pay more for your product, but to pay less for your product because we're the big purchasers behind it all. So we can do that. I also want to make sure that we start giving more information to people with disabilities so they can shop around for the best deal. I also want to start creating a change of culture in the whole, from the NDIA right through to punters, saying that it is completely uncool, inappropriate, unethical to take opportunistic advantage of a person with a disability, because the money that that person with a disability spends on an inflated price means they've got less to spend on something else which could be more valuable to them, frankly, and better outcomes for the people. Yeah.
Well, since I broke this story on Monday, I've had quite a bit of correspondence, as you can imagine, and it's all one theme. It's all about overcharging. So I've heard a story of an NDIS-approved carer costs $68 an hour and $120 an hour on the weekend. Someone involved with that said to me they believed this was above market rates. I had correspondence from a gentleman who bought a cushion online for half the cost he could get it from an NDIS supplier. It does sort of look like if you could crack down on this, this is where your best savings is going to be. This is where you can make real inroads.
Well, the point about the scheme is that taxpayers don't mind modest payments going to people with profound or severe impairments, because it could be any of us or a family member. But what I think gets on everyone's goat, from the participant right through to the taxpayer, is if there's third parties trying to feather their own nest, trying to build the veranda on the second story of their beach house somewhere by overcharging people with disabilities. So I give fair notice to the price gougers, the rent seekers, the opportunists, that you may have had a business model which involved inflated prices, exploiting vulnerable people. We are going to crack down on this. We're going to out you. You'll be shamed. We're going to do everything we can in our power, because this scheme's too important to have false inflating of costs by third parties who are taking money, effectively robbing people with a disability.
Mr. Shorten, what's happened with the blowout in this scheme? Do you take any personal responsibility for it? Because didn't you design the scheme?
Oh, mate, the last 9 years we've had a coalition government. The NDIS is a good idea and it's here to stay, and it is sustainable. But it's been managed like a a kindergarten kid's finger painting concert. You know, it's unbelievable. There's so much happening. It's very complicated. People with disability are sick of being told it's their fault the scheme's too expensive. It's not their fault. What we want to do is make sure that there's longer term plans, that the agency, the people who the people with disability deal with, know more about their disability. It drives people with disability to distraction. It's demoralising when they've got to keep annually telling someone, yes, I still have Down syndrome, yes, I'm still a quadriplegic, yes, I've still got, you know, my serious, amputation, yes, I'm still blind. You know, annually we ask people to repeat this sort of information. I think there are, in the next 3 years, lots of low-hanging fruit by working with people with disability, just listening to them rather than lecturing them, where we can help moderate the cost growth for the scheme.
I think you've spoken about 3-year business plans. Instead of a 1-year business plan, you've got to draw up with NDIS public servant help when you've got the same problem. You're looking at that.
Yeah, absolutely. Longer-term planning's part of it. I mean, some people might have, if you've got multiple sclerosis or MND, that's a degenerative condition, so you might, a 5-year plan mightn't be appropriate. But as a general default position, when you've got a permanent and severe disability, why do you have to go through the annual Hunger Games, the anxiety? We end up paying for more reports to tell the government the same thing that we already got in the last report, and also creates perverse incentives. If everyone thinks, oh, I've got to spend all my money in the 12 months to make sure I can't, if I have an unspent portion, it's not taken off me. We've just got everyone take a deep breath. This scheme's about giving people with severe and profound impairment assistance with core functions of living. It shouldn't be an annual sort of tick and flick paperwork process which causes more trauma than, you know, you're trying to solve.
But the fact when it was set up, there was no cap in terms of federal spending on the scheme. Do you admit now that was a mistake?
No. I want to be very clear here. The NDIS is a demand-driven program like Medicare. We don't say to sick people, this is a capped scheme, so if you get sick after April of a financial year, you've got to wait till July before we give you medicine. With NDIS, if someone gets a disability, well, they've got the disability, so it's not a capped scheme, it's a demand-driven scheme.
Yeah, but you've introduced a growth target now. You've introduced a growth target of 8% now. You're trying at least to say it shouldn't grow by more than this. That never occurred at its inception. Was that a mistake?
Well, if you're asking me to take responsibility for the 9 years of the coalition, I'm not going to do it, mate. But what I am going to do is take responsibility to make sure the scheme is here to stay and make sure it works in the best interest of participants.
Now, we have a review.
Coalition ministers come on? But why didn't coalition ministers come on your show year after year and say, hey, there's price gouging out there? Were they asleep at the wheel? They didn't know what was going on? Why didn't they come on and say 1-year plans are stupid? Why didn't they come on and say, why do we ask people in wheelchairs and with white canes to keep reproving their disability year after year?
Will we hear more in the budget in terms of what you're going to do to crack down, any specifics, or does that wait for this review that you've commissioned? Okay, so what sort of things, without giving away the budget, can you tell us will be in there?
Oh, mate, you're killing me here. You're killing me here. It's only a few more sleeps till budget night. There will be more detail about our reforms, about improving the scheme. And absolutely, ever since we got in day one, we've changed the leadership of the agency. Of the 11 most senior people in the agency when I took over, there's one left. We've got new leadership. Half the board are now people with disabilities. We've got Kurt Fernley, who's a rock star, as the chair. We've started getting people out of hospital who are medically fit for discharge and not waiting 6 months after they're fit for discharge, stuck in hospital. We've also been hitting all the legacy court cases which were around at the time of the election. The review is important. It's coming down October. We're doing a lot of work with a lot of people on that. But some of the ideas that we've articulated, the National Press Club, and we'll have in the budget, that's what people with disability have been telling me for years. So what we're doing is, it's like coats of paint. We put one coat on, one change. We're going to keep doing it. Improving the scheme isn't one day in the year, it's every day in the year.
Bill Shorten, thanks so much for your time this afternoon.
See you Tuesday night. Cheers.